months. I think I didn't skip anyone. Then 5 technical providers, and of course some patient associations that support this work. Several innovations we plan in this project. It is AI algorithms and analytics, a mobile app for patients and healthcare professionals, with which patients and healthcare professionals will be able to monitor functions and to get risk stratification, early diagnosis, and disease progression. Here we can see the scheme of our project. For now, today protocols rely on medical history, physical examination, blood test, ECG, and echocardiography, but we plan to include in this course test, which is developed by our partners from UK, and one novel method is voice recognition as biomarker for heart failure that will be implemented in this decision support system and mobile app. Besides this technical innovation, of course, we have the whole work package within this project, which will evaluate the economic and cost effectiveness of this solution. So this is something that we plan to do with this, within the project. I want to emphasize that the project is still ongoing. It's on the half of its lifetime. So we have 2 more years, and of course after the project to validate this. We have some challenges in heart failure management, difficult diagnosis and comorbidities, high rates of hospitalization of patients on which end the diagnosis is not confirmed, so economic burden on healthcare system is huge when managing the heart failure. Expected impact of these management programs are to reduce hospitalization, improve patient outcomes, enhance follow-up and monitoring, reduce healthcare costs, and of course enhance the quality of life of these patients. These programs typically focus on multidisciplinary approach, including self-care education, medication management, follow-up care, resulting in fewer hospital readmissions, lower healthcare costs, and improved functional status. I will skip this slide because this is just the overview of the literature that we will use within the project to obtain results. Here you can see most common resource use or structure of costs within the healthcare system. The majority of costs is going to hospitalization of these patients, of course, primary care visits, emergency room visits, home visits, general practitioners, nurse, etc., etc. Here we just made the 3 sets of common resource use: medication, laboratory tests, and diagnosis. And of course other resource use or other costs already, okay. So I will just skip that. From the studies that were performed so far, here we can see some average costs in some countries where these studies are conducted very carefully, and here maybe you can notice the 2 figures marked red, and the variety of this cost is huge, from 600 to almost 2,300 euros, but it depends on the healthcare system in the specific country and in the structure of cost that we are taking in count. Of course, heart failure as a disease has indirect costs, productivity losses due to sick leaves of the patients. There are estimates about 12,000 euro per patient per year, but these costs are often underreported, which is the other problem in this If we analyze Serbia, there are limited data available and limited studies that are conducted so far. We found a study which performed AI ECG screening study in Serbia, and the result of this study is that quality is the quality adjusted life year. It's the standard for measuring how well some medical procedures are can improve patients' lives. Okay. If we consider the results of the study, the quality is most cost effective in the patients group age 65. Key findings from Serbian study that this screening is cost effective because prevention is of course much cheaper than healing these patients. And further, of course, further validation of research is needed, and this is the good hypothesis for further research on impact of AI tools to cost effectiveness in healthcare. Some conclusions and recommendations from Stratify that this tool, once it's developed, will improve risk assessment at first. It is the great potential to lower healthcare burden on healthcare systems. That earlier diagnosis reduce long-term costs of treating the patients with heart failure, and of course it improve their lives, improve of course underreporting of indirect costs, and the need for standardization across studies, because it is very hard to compare some studies in different countries due to different healthcare systems. Here I tried to make a QR code with a link to our LinkedIn page, but I tried it now, it doesn't work. Yesterday it worked. So if it doesn't work, I invite you to follow us on LinkedIn, Stratify HF EU project page, and of course we have a website where we publish our new results of the project, stratifyhf.eu.